Hello, the title of this study was The Relationship Between Patient Safety Competency and Safety Education of Clinical Nurses. The chief author is Jung-hyun Choi, and the correspondent author is KyoungEun Kim, Namseol University. The contents were as follows: Introduction, Materials, Analysis results, and discussion. Introduction. On 17 September 2020, the World Health Organization will commemorate World Patient Safety Day. The objective of World Patient Safety Day 2020 campaign is to raise global awareness about the importance of addressing patient safety and health worker. According to the report called 2R is Human, experts estimate that as many as 98,000 people die in any given year from medical errors that occur in hospitals. That's more than die from motor vehicle accidents, breast cancer, or AIDS. The Institute of Medicine stated that all health professionals should be educated to deliver patient-centered care as members of an interdisciplinary team, emphasizing evidence-based practice, quality improvement approaches, and informatics. In order to ensure patient safety culture has to be formed, which means that members of medical institutions basically considered patient safety as very important thing, give it the highest priority. A patient safety culture must be a set of beliefs, values, and behaviors shared by organizations, departments, and individuals in hospital to prevent medical errors that may occur during the provision of medical services. The purpose of this study was to examine the variables affecting the patient safety competency in clinical nurses. It is also to provide basic data so that effective strategies can be established in preventing medical infections. Method. This research is a descriptive correlation study designed was to examine the variables affecting the patient safety competence in clinical nurses. The data was collected via structural questionnaires gathered by 170 hospital nurses and staffs who agreed to participate in the study, and 165 of them were analyzed except for 5 incomplete questionnaires. The data was collected from September till December 2019. Patient Safety Attitude. Patient Safety Attitude Scale, announced by SCOMO, was used in this study. It is composed of 14 items, which were scored using 5-point Likert scale. The Cromba alpha coefficient was 0.92 in this study. The perception of patient safety culture. The patient safety culture scale developed by Lee was used in this study. It is composed of 35 items: leadership, teamwork, patient safety knowledge and attitude, patient safe policy and procedures, non-punishment environment, patient safety improvement system, and patient safety priority. Items are evaluated with 5-point Likert scale. The Cronbach-Alpha coefficient was 0.93 when the scales were developed. Safety control. Safety control scale developed by Anderson was used for hospital organization members in this study. It is composed of 7 items, which were scored using a 5-point Likert scale. The Cronbach-Alpha coefficient was 0.484 in this study. The collected data were analyzed with SPSS and Amos statistical program. Several descriptive statistics, Pearson product movement correlations were used. To evaluate the fit of structural models to the data, the standard chi-square index of statistical fit, the root mean square error of approximation, Tucker-Lewis index, and comparative fit index were used. Results. Table 1 showed general characteristics of participants. Participants were 165 nurses, 20 males, 6.1%, and 155 females, 93.9%. Participants ranged in age from 20 to 58 years old. Median was 36.36 and 10.12. Descriptive statistics for the perception on patient safety culture, safety control, and patient safety competency of nurses are shown in Table 2. The level of patient safety culture, safety control, and patient safety competency of nurses was 3.17 plus minus 0.57, 1.93 plus minus 0.70, and 3.23 plus minus 0.60 point each. Correlations are shown in Table 3. Nurses' perception on patient safety culture and safety control were positively associated with patient safety competency. However, the number of attending safety education, the experience of medical institution certification evaluation, and clinical career were not significantly associated with patient safety competency of nurses. The analysis of the hypothesized model indicated a good fit to the data. Chi-Zegov 2.67. The path from the frequency of safety education to the perception on patient safety culture and the path from the perception on patient safety culture to safety control and patient safety competency of nurses were significant. The path from safety control to patient safety competency of nurses was significant too. However, the path from the frequency of safety education to safety control and patient safety competency of nurses were not significant. This result partially supports the hypothesized model. To improve the fit of the model, we examined the fit of an alternative model. An alternative model was nested model. An alternative model did not have the path from the frequency of safety education to patient safety competency of nurses. The alternative model indicated a proper fit to the data. The paths in alternative model were significant except for the frequency of safety education to safety control of nurses. The alternative model was found to be a better fit to the data comparing these two models. The table 4 showed regression weight of alternative model. Conclusion. In this study, we conducted a survey to examine the variables affecting the patient safety competence of clinical nurses in Korea. This research will be helpful to support for nurses to improve their safety capabilities for patients. However, this study did not reveal a direct and indirect association between variables affecting the patient safety competence of nurses. The structural relationship between personal and environmental factors affecting the patient safety competence of nurses should be included in future studies. Thank you for listening.